Welcome to Bonnie's Beat. I'm your host, Bonnie Squires. We're coming to you from Radnor Studio 21 in beautiful downtown Wayne. And we like to share with you the important people in our community who are doing important work, either for charity, for medicine, academia, arts and culture. And if you saw the recent Inquirer article about Bryn Mawr Hospital's $200 million plan to expand and renovate, I jumped on the phone and I called the president, Andrea Gilbert, and here she is to tell us all about it. Hi, Andy.
Hi, Bonnie. How are you?
Thanks for coming.
Delighted to be here.
200 million. That's a nice round number.
We like to work in round numbers.
But before you could go public with that, you had to do a lot of groundwork and get a lot of...
Right.
Can I ask you how much you had pledged ahead of time?
Well, we're in the middle of actually the very front end of a major capital campaign, but we have also been planning this project for over a decade. And so, you know, our eyes have been on a major modernization project for the Bryn Mawr Hospital. And so, you know, our operating bottom lines have been focused around the need to really fund this project out of, large part out of operations. So we've been working up to this for a long time.
My mammogram every year is at Bryn Mawr's Women's Breast Center, and I think Bobby Brodsky is the one who endowed that.
She sure did.
She's done a lot of wonderful things.
Oh, she's an incredibly generous lady.
It's so civilized there, and it's so private, because I used to get my mammograms, I won't say what hospital, where I have all my degrees from, but they have this waiting room, and you're all sitting there with schmatas on, and it's so embarrassing, you know? And it's nice and private, and nobody sees you, and you can pretend you're not there. You know, you can work on your BlackBerry or whatever, your iPad. So, and Bryn Mawr Hospital, a friend of mine, Dr. Hal Robinson, used to be the head of the cardiac, whatever medicine there, and he was just wonderful.
Right. We've had lots of great legacy physicians, and it's one of the great traditions of the hospital. And so, yeah, we're just moving forward in terms of the deep roots that this hospital has had in the community for a long time. Now,
what's going to change in the physical plant with the $200 million investment?
Right. Well, we are going to be building a new patient pavilion. And it's, again, the zoning for this was really enabled back in 2007. The new building will be in the center of the campus. The hospital actually sits on a sort of a triangle with Bryn Mawr Avenue, County Line Road, and Old Lancaster Avenue. And it's going to be in the middle of the campus, not terribly disruptive, thankfully, for the community.
Will it be in front of the hospital? Or?
No, it's going to be embedded. I don't know if the Clothier building, which was the original nursing dormitory, and we had a small medical office, South building, those two buildings came down this fall, and creating the footprint really for the future. And so we'll create...
Oh, I like that, footprint for the future.
We do too. It has a nice ring, doesn't it?
Was that your idea?
It takes a village, as you know, Bonnie. So we have the new building will be in the center of the campus, attached to the existing hospital structure, and will be basically a five-story building, four-story building with a basement, a ground floor, and then several floors above it. We'll have the capability to build in the future vertically up to an additional 4 stories, but we'll start just to, and our goal isn't to expand the hospital. In fact, as we look at the future of healthcare, we know that inpatient hospital utilization is actually declining nationwide.
Interesting.
But we are looking to create all private rooms. That's obviously the standard. And we will be renovating a substantial part of our maternity units as well. So that's really the major focus. All private rooms, new critical care floor, and all new operating rooms. So very exciting for the community, and we think...
All new operating... Oh, now I know why it's a $200 million price tag.
Right.
All new operating rooms means all new equipment. And that's the most expensive of everything, right? And not only that, but if the computers are outdated every 6 months, I don't know what the lifespan is of surgical machines that depend on computers.
Sure. So a lot of technology. We have continued to update across our health system our clinical technology. Some of it will be new equipment, some of it, we've just purchased this year, we'll move into the new building. So, but all of the patient rooms are, we call them acuity adaptable. So they're all the same size. They're, what's different is how we staff them and what types of equipment is in the room. But, for hospitals, flexibility is critical. I mean, healthcare is an incredibly dynamic and changing world, and to build for a project and for a community that's going to need to support the needs of this community for the next 20 or 50 years, you've got to be thinking how to make something that is as flexible for the future as possible.
Is Bryn Mawr Hospital the queen of the mainline health system? You can be honest.
Depends who you ask. We're all special, Bonnie. Truly, the assets in the mainline health system are extraordinary. I think when you think about what's available for this, I don't know, I'm going to guess, million person community in terms of all of this of the community served by the mainline health system. We each have our strengths and our niches, and we're trying to.
You got Lankenau, you got Paoli.
Lankenau, you got Bryn Mawr, Paoli, Riddle is now one of the hospitals in our health system. We have an incredible Bryn Mawr Rehab hospital out in Malvern.
Oh, I was out there when Peter Leocoris had his stroke.
Yep.
My honey, whom I worked for years, when he was president of Temple University.
Yeah.
Yeah, Bryn Mawr Rehab, and you do amazing things with Bryn Mawr Rehab because people that suffered brain damage, but part of the therapy is art therapy, and you have this fabulous art show every year.
We do.
And the art is amazing.
Yeah, it's called Artability, and I'm not sure exactly what time of year it is. I think it's in the spring, and it's wonderful. It's a juried art show of people from all across the country who have had, deficits and all. And my colleague, Donna Phillips, who is president of Bryn Mawr Rehab, it's one of their great contributions and events. But is Bryn Mawr the queen? We're all queens. We all have our expertise. On that note, in terms of stroke, Bryn Mawr does provide the interventional stroke care for the health system, for our mainline health system. So we have the most sophisticated interventional stroke capabilities. But again, each of our hospitals, we try and ensure that we don't duplicate services that are costly and don't need to be duplicated, but are able to serve our health system. Bryn Mawr provides the inpatient pediatric care, the inpatient psychiatry care for the health system. So lots of things that are at Bryn Mawr and not elsewhere, and lots of things that are elsewhere and not at Bryn Mawr. So
a lot of hospitals have been closing down their maternity wards. I don't know why. Does Lankenau still have a maternity ward?
Oh yeah, I mean the mainline health system, each of our hospitals, actually all 4 of our acute care hospitals have thriving and very important maternity programs. I think where you've seen that over the recent decade has been in the urban environments where Medicaid is just and the federal payers are just not supporting the inpatient requirements for maternity care, which is expensive.
I wanted to ask you about Obamacare and what the impact has been on Bryn Mawr Hospital and all the hospitals in your orbit.
It's a complicated question because
I mean, I love President Obama, but I spend a lot of my time defending him and defending Obamacare. And the only thing I know about to say, yeah, but if your kid is 26 years old, you can still keep your kid on your insurance. That's wonderful.
Yeah, I mean, there's a universality about coverage, which Obamacare, I think, is responsible for, and that's, we think, from my personal point of view, I think that was a very important move for this country. A lot of people confuse Obamacare with what has happened and already started to happen well before the federal legislation was enacted regarding how healthcare is paid for and financed. And so, the payers, the Blue Cross, the Aetnas, the commercial insurances, Medicare, which is...
I have to say Aetna, when U.S. Healthcare sold out to Aetna, I saw a neon sign go up in the sky saying, oh my God, the insurance companies are now going to decide what you're allowed to have for health care. I was very upset about that.
Well,
And the Abramsons are amazing people, and look what they did down at Penn,
Sure.
$100 million, but I did not approve of that. They didn't ask me.
Right, right. Well, the way healthcare is paid for in our country is very complicated, and we all know that. And hospitals are, one of the spokes in the wheel on this. I think, everybody sort of gets a bad rap. Obama gets a bad rap. The payers get a bad rap. The hospitals get the fact of the matter is it's very complicated. It's probably too complicated. We all suffer because of that. But universal coverage, or the attempt to cover more people for health care, I think is a good thing. There is no question that people are paying more of their own dollars for care.
You got that right.
Right? Whether it's through your premium or through co-insurance or co-pays.
Copay.
And that has an impact because we're providing care, and many hospitals across the entire industry just are not getting paid. So there's this, it creates, greater challenges for hospitals and all providers to figure out how to make the costs, how to support the costs of providing health care.
We want to put up on the screen the information about Bryn Mawr Hospital. If people want to, if they want to Google www.mainlinehealth.org/Bryn Mawr, the phone number is 1-866-CALL-MLH, which stands for Mainline Health. What are the numbers under Call MLH? Do you know? I never know that. It's hard to figure that out. Oh well, just look at your telephone, call MLH, and then you'll figure out what the numbers are. Okay. I always like to find out the background of people.
Yeah.
And your Bridget was very nice and sent me a whole thing about you. And you once worked at the Department of Health in D.C.
I did.
I was in Washington very recently, meeting with Congressman Brady, Congressman Boyle, some others, somebody on Senator Toomey's staff. But what was your training? Where did you go to college? Are you a native of this area?
I'm actually not. I'm from the New York area. Grew up on Long Island.
Long Island, but you don't talk like a Long
No,
Islander.
I don't talk like a Long Islander.
Do you say chocolate?
No, I don't. Fond of New York, but most of my family is in fact, all of my family is not on Long Island any longer. I have some kids who are in New York City, but
where in Long Island? What city?
I grew up in Great Neck. My kids currently, I have 3 daughters. One is living in Brooklyn with her husband and works in
Brooklyn is the
Manhattan.
new millennial hotspot.
It's amazing.
From everything I read.
Oh my
my
gosh,
goodness.
it's amazing.
That's why Hillary Clinton picked Brooklyn to have her headquarters. Go Hillary.
Yeah.
Sorry.
Yeah. So I'm an undergraduate of the University of Wisconsin in Madison, Wisconsin.
How'd you get to Wisconsin from Long Island?
Yeah. I sort of wanted to escape the Northeast and
go where the weather was balmy.
was terrible, right? No, they actually have one of the best at the time indoor tennis stadiums, and I was a tennis player, and so.
Were you on the school team?
I was, yeah. So
Were
that
you
was
like
a lure.
ranked nationally?
Our team was. And
wow.
Yeah, no, we played in the Big Ten. It was big time at that time, but we're talking a bunch of years now. So.
At Penn, I was on the varsity volleyball
There you
team
go.
when Jewish girls who were 5'1" who played at camp in the summer could be the stars.
There you go.
Because they didn't have such a thing as spiking then. As soon as they changed the rules, that was the end of us.
There you go. But it was a great experience, right?
Oh, it was wonderful.
Right.
We won the championship. They gave us a dinner in the Mummy Room at the Penn Museum. Oh, yeah.
That's great. College sports, I'm all for it.
Yeah.
It's great. But that was the lure, part of the lure.
What did you major in?
I was a history major.
Oh, well, so it's
There
a
you
natural
go,
segue
right?
to
There you
being
go.
president of a hospital, right?
Lots of physicians in my family. My dad was a major influence on me. He was a very prominent physician, OBGYN in New York City, in the New York area. My brother was a physician. So.
Was there pressure on you to go to med school?
Oh, absolutely, yeah.
How did you resist?
Well, I decided, in fact, that as interested as I was in the area of medicine, I just never felt the calling around being a provider, and I was fascinated by health delivery. And so I ended up going to public health school and getting a degree in public health.
And where did you get your graduate degree?
I came back east and went to Johns Hopkins and spent 2
nice.
years there. Yeah. And that's essentially how I ended up closer to Washington, D.C., because after my graduate degree, I gravitated to Washington and spent the first couple of years out of graduate school working in health policy in the government.
And you worked for the Department of Health?
Department of Health, Health Education and Welfare, at the time, Department of HEW, yeah.
Who was the secretary in those
Secretary
years?
Califano.
Joe Califano. Oh, what a treat that must have been. Isn't he brilliant? He has resurfaced recently. He had a big op-ed in defense of, I can't remember what he was defending now, but I said, go Joe,
Yeah,
you know.
yeah.
It was wonderful.
Yeah, no, he's a very dynamic guy. Sort of lost track. But anyway, I spent a couple of years doing that and then gravitated to the hospital sector after a couple of years.
And what was your position before at Bryn Mawr?
Well, I've sort of been in the administrative teams of hospitals since my first hospital job, which was in Fairfax, Virginia, and then came to the Philadelphia area for family reasons. My husband and I had our one-year-old daughter at the time, and some of my family was here. So I joined the hospital. The hospital position that I took just before Bryn Mawr was a CEO job at the now no longer existing City Avenue Hospital, which was PCOM's original osteopathic hospital.
Oh, sure.
And I was part of Hahnemann and MCP, and we were transitioning to transition that hospital to a women's hospital. A failed effort, a very fascinating one, but I was involved with that effort and initiative.
Well, you learn a lot from failure.
Absolutely.
And then how did Bryn Mawr get lucky enough to get you?
Was recruited back in 2000, so I've been at Bryn Mawr for 15 years now.
Oh, it's a long time.
Yeah, it's been great.
And you've been president for?
In the senior role for all 15 years. Originally, when I took the position, we were senior vice presidents of the mainline health system. There were no president titles, so we sort of went through a title change back in 2002. But it's been great. It's been a great organization. Work with some of the best people I know.
And when will the construction begin for the $200 million makeover?
Right. So we're in the detailed design work.
Not good asthma weather these days.
Right. I know somebody can help you about that. So we're in the detailed design phase now. We'll start.
Who's the architect who's designing for you?
We're working with a group that's helped Mainline Health just finish the major project at Lankanaw. They're called RTKL.
The Heart Pavilion? Mm-hmm. That's a great building.
It's a fabulous building.
I have to take my mother over there because her doctors are over there.
Yeah, it's really a fabulous project. So we'll start construction a year from now, but we have a couple of things happening now. We're working on our central utility and a lot of our utility and infrastructure work now in preparation.
You'll do a lot better than the guy who bought Revel, I'm sure.
Yes, absolutely, no doubt. I'm not worried. And we're actually going to start with a new medical office building that will be starting late this summer, and we're expanding our existing garage by 2 levels. So there'll be some construction that starts as early as this summer, but it's not the patient pavilion. The patient pavilion project will start a year from now and will be completed by 2018.
Are you going to have valet parking for the patient pavilion?
Absolutely. We do now.
I can't understand why Presbyterian, which belongs to Penn.
Yes.
My pulmonary guy is there.
Yeah.
But there's no valet parking down there. Till I found out that there was a little parking place right behind the back entrance to his office. He's on the ground floor.
Right.
I would drive around for hours, I didn't want to go up multiple levels. It's
hard.
No,
there's no question. I mean, the challenges of wayfinding and making access in a congested area easy for patients and families is a challenge. It's one of the things that we're very focused on, and we will make sure that we really address those issues head on.
How many doctors do you have on staff at Bryn Mawr?
I mean, technically, we have over 1,000 physicians on staff. Active.
1,000?
Yeah, but
that's a lot of Christmas presents, Andy.
No, but in terms of active physicians who are coming to the hospital every day, either as a primary care physician or a specialist, it's a couple of hundred.
That's still a lot.
Yeah, yeah. I mean, it's a very robust hospital system.
And nurses, how many nurses are on staff?
Oh my gosh, probably about the same, about 1,000 nurses, 700 to 1,000 nurses.
What's the difference between a nurse and a physician's assistant? I'm trying to figure that out.
Very different. A physician's assistant's training is different, very different. A physician assistant has to work under the supervision of a physician. Do you mean, and a nurse has very different training, and again, it depends on whether they've been to a
four-year or
four-year
two-year
program, and a lot of that is currently under evolution. A nurse practitioner and a physician's assistant a PA are often considered to be similar. A nurse practitioner takes additional training beyond an RN degree. So there's an additional year or two, depending on what type of clinical area you're training for. A PA, again, has to work under the direct supervision of a physician. A nurse practitioner can function independently. So they're very different, but we use them as extenders for our health care delivery system, and we're bringing on, we can't recruit nurse practitioners fast enough because of the way healthcare is evolving, and we know that there are just not enough physicians to support, particularly in areas of like primary care.
Oh, there was just an article that I read that said, like, Pennsylvania has experienced a shortage of physicians. Mm-hmm. I'm thinking, with all the med schools we have, how is that possible? They go elsewhere?
Well, they go elsewhere. The medical schools have, and the residency programs, because physicians after medical school have to, train additional years in their area of specialty. And the resident slots have been frozen since the 70s. And so even though the schools are generating students, there are not enough slots there are an excessive number of students for the number of slots, residency slots. So there's been a sort of a deliberate process of maintaining the supply of physicians, and it's just not kept up with demand. So it's a national issue. We see it most problematic in certain areas of the country. We know that in primary care, it's a universal area. No matter where we are across the country, there are not enough physicians to keep up with the current and expected demand in primary care. So PAs and nurse practitioners become very critical.
And what's the solution when a doctor says, I don't want to be on call 24 hours a day, 7 days a week? How do you make it so that they could have a life in addition to being a primary care physician? Mm-hmm. I mean, a few of them are so dedicated that, yes, you'll call them, they'll give up dinner at 8 o'clock on a Saturday night and run back to the hospital to go see a patient. But there aren't too many like that, are there?
I mean, I think that expectation for the next generation is of both of physicians, and we're seeing it now. It's just the lack of having any real life is just not an option anymore. So what do? We employ physicians and we pull them into larger practices, group practices of other providers so that we can share call. We do what you just suggested. We bring in extenders like nurse practitioners and PAs who can provide additional coverage and support. We triage a lot of patients, in those settings. So we have an organization called Mainline Healthcare. It is our health system's physician employment.
If you're wondering what call MLH is really in numbers on your telephone, it's 1-866-225-5654. That's 1-866-225-5654. So, or 1-866-CALL MLH, Mainline Health. Okay. And we were talking about shortage of doctors.
Yeah.
None of your 3 children opted to be doctors?
No. I have 3 daughters, and none of them are in the healthcare field. But I think they have a high respect for it. But they're all doing fascinating things.
Like what?
Well, my oldest daughter just published a cookbook.
A cookbook?
A cookbook, and she's the rage on all kinds of places. She wasn't trained as a chef. She went back to culinary school after a 4-year college stint, and just somehow got involved and interested in cooking. And
what's the name of her book?
It's called Sheet Pan Suppers, and it's everything you can make on a sheet pan. It's kind of like the crock pot idea, but it's on a sheet pan, and it's breakfast, lunch, and dinner, and you can buy it on Amazon, and you can get on her blog. She's got a very, very active blog. And
what's her name?
Her name is Molly Gilbert. She's adorable, if I don't say so myself.
Objectively speaking.
And my middle daughter, our middle daughter is Emily, and she is in the fashion world and works up in New York City for J. Crew as a merchandise person, a buyer. And our youngest daughter is thankfully in Philadelphia, and she spent a couple of years teaching in the charter school world in New York City and here in Philly, and is trying her hand in human resources. So this is a new venture for her, and so she's doing some great work there.
What does your husband do?
He is a semi-retired attorney.
Too young. Too young.
Loves doing. He's a healthcare attorney actually, and spent most of his career in healthcare.
A match made in heaven.
There you go. And he is right now spending a lot of his time coaching urban boys basketball. And he's a basketball and baseball guy, and he's a great coach, and he's enjoying that very much. So.
I hope you find somebody like Monet Davis. That would be very nice.
There you go. There you go.
That's the little girl who was on the boys. Well, they didn't win the overall championship for the Little League, but she was the first girl to be on a boys team, and she got her picture on the cover of Sports Illustrated, and she didn't even have to wear a bathing suit. So that was really amazing.
She's still doing great things. Yeah.
Oh, I think she wrote a book, and you see her on television, and she's so well spoken. She's only like 12, 13 years old.
Very poised young lady.
Oh my goodness, she's amazing. There must be colleges lining up to give her full freight.
Oh, absolutely, I'm sure.
Oh, wow. So if you had a magic wand 5 years from now, what would you like to see at Bryn Mawr Hospital?
It's a good question.
Gold faucets in the new bathrooms?
No, not at all. Well, I'd like to make sure that the work that we've been proud to do continues, and I have no doubt that it will. I want to make sure that we continue to be the safest, best place to get health care, a goal that we continue to strive for and I think are very much nailing. I think our health system is really delivered that for our communities.
Are you half in Montgomery County and half in Delaware County?
No, we're actually on the border of Delaware, but we are all Montgomery County.
Oh, then you've got Josh Shapiro and Val Arkush.
Absolutely.
And
those other great Democrats.
Yes. Bruce Castor, okay, but he wants to run for judge. He's not going to be there.
Well, we've got
longer.
Very supportive leaders, whatever party they are. We've been very fortunate.
What about in Congress? You must need help from the feds also. And you've got experience because you worked in D.C.
Right. Well, you've constantly have to make the case for the support of hospitals. We're constantly worrying about, how to fund an ever-growing and expensive health system and health delivery. So, making sure that on the one hand that we're responsible providers and being very focused on value and making sure that we're not, this notion of, well, I go to a hospital and it's going to cost me $100 for an aspirin, is something we're very focused on.
That's a bargain. Only $100.
Right. But if you knew how hospitals were paid, you'd know that that's a red herring, actually. It's not at all. What you see on your bill is not what hospitals get paid. So
that's true.
It's a whole other conversation.
A fraction of what it actually costs. People have no idea how much it costs when you use an MRI or you use some of the sophisticated equipment. They have no idea.
Right, but our challenge is, and as you say, waving the magic wand, I think we all want to be more efficient. We want to make sure we're not duplicating a test that was done a month ago, or that we're sharing information better as a health delivery system between a provider that, a doctor you may have been seeing, your experience at Presby. We want to make sure that we are working to have all of that data safely and confidentially available for your next care provider, whether that's in our system, I hope, at our hospital. So the management of health information to drive a much more efficient and safe and high quality experience, I think, is the challenge for all providers and health systems. I think we're doing a great job, and we'll continue to really raise the bar in that area over the next bunch of years.
Our guest today has been Andrea Gilbert, who is the president of Bryn Mawr Hospital, and a really smart cookie, you can tell. And we'll see everybody next week.